Equipment. Incubator. This is a clear plastic bed that helps keep your baby warm. You can touch your baby through the holes, which are also called ports, on the sides of the incubator. Heart or cardiorespiratory monitor. This is a machine that tracks your baby's heart and breathing rate. It is connected to your baby's chest with small sticky pads called leads. Information from the monitor displays on a screen and can be printed out. If your baby's heart or breathing rate becomes too fast or too slow, an alarm will sound. Blood pressure monitor. This is a machine connected to a small blood pressure cuff wrapped around your baby's arm or leg. The cuff takes your baby's blood pressure at regular times and displays it on a screen. Temperature monitor. A temperature probe is placed on the baby's skin with an adhesive patch. A wire connects the temperature probe to the overhead warmer to help regulate the heat needed to keep the baby warm. Ventilator. This is a machine that helps babies who cannot breathe on their own or who need help taking bigger breaths. Overhead heater. This provides overhead heating to help keep your baby warm. Providers may use a warmer instead of an incubator if your baby needs to be handled a lot. Phototherapy lamps. These lamps provide bright blue light over the baby's incubator to treat severe jaundice in the neonatal period. Umbilical artery catheter. This allows blood to be taken from a baby at different times without repeated needle sticks. It can also be used to continuously monitor a baby's blood pressure. Intravenous infusion pump. This is a pump that infuses fluids, medication, or nutrients into your child's circulatory system. Pulse oximeter. This is a small device wrapped around your baby's foot or hand that measures the oxygen in his or her blood. It does not cause any pain to your baby. It helps providers know if your baby needs more or less oxygen. Endotracheal tube. This is a small plastic tube that goes into a baby's nose or mouth and down to the windpipe, also called the trachea, and sends air and oxygen to the lungs. The tube is attached to a machine called a mechanical ventilator to help your baby breathe. Intravenous line, also called IV. This is a tube inserted with a needle into your baby's vein. A vein is a blood vessel that brings blood back to the heart. Your baby can get fluids, medicine, and blood through an IV. Continuous positive airway pressure, or CPAP. A machine that sends air and oxygen to your baby's lungs through tubes in his or her nose or windpipe, which is also called the trachea. Feeding tube. A tube that goes into your baby's stomach for feeding. Liquids go through the tube to feed your baby. The tube is used for babies who cannot take food by mouth and need long-term help with feeding.